everyone, I'm Youn-Bum. First of all, it is an honor to present at an international conference. The theme of my thesis is descriptive discussion of the effect of intervention method using robot to improve the upper extremity function of stroke patients. Then I will start the presentation. Introduction. One of the most common issues for many disabled elderly individuals around the world is stroke caused by cardiovascular disease. The number of patients with stroke reaches around 62 million around the world. The number of hospitalized patients due to stroke from 2000 has increased annually, and the compound annual rate was 6.4%. The survival rate after onset of stroke was 80% in Korea, which is relatively higher than the other major causes of death. But 64% of the survivors has disabilities, such as sensory motor loss in the upper and lower extremity. More than 70% of patients have paralysis in the function of upper extremity, and more than 60% have disgratation and dexterity. The recovery from stroke occurs the most within 3 to 6 months after occurrence of stroke, and the rehabilitation treatment in this period can facilitate function recovery with the help of neurological recovery. Since patients within 6 months after the occurrence of stroke cannot do exercise themselves, they need help from therapists. The reason of focusing on the rehabilitation of upper extremity functions among many various problems in patients due to the damage to the middle cerebral artery, which is responsible of upper extremity functions and accounts for 75% of stroke. The weakness of the upper extremity can disturb the independence of patients in performing daily activities, thereby increasing their response on others. In particular, if a patient with upper extremity is on the same side as their dominant hand, the patient will need help in most daily activities, such as eat, washing, toilet, dressing, and appearance management, which can degrade a patient's quality of life, as well as family members who are close to the patient. Thus, the goal should be to send not only reduce in the expansion of brain damage during the subacute treatment phase, but also to decrease the patient disability due to the after effect through the problem solving process after subacute phase. Main body. Uh, Robot assisted rehabilitation has been developed to improve activity of daily living in patients with upper extremity disability for the past 20 years. From the 1990s, various rehabilitation robot device has been developed in Destructive around the USA and Europe, and study and on the effect has been reported. Since robot-assisted rehabilitation is more advantageous in repetitive and high-strength training than conventional rehabilitation treatment, many proofs are increased that they are effective on improve the upper extremity function of patients. For example, muscle strength, joint range of motion, and coordination ability. However, answers to more meaningful questions are needed to draw the effects through robot assisted rehabilitation to the maximum. Robot assisted rehabilitation has been limited to correlate recovered upper extremity functions of patients with activities of daily living. One of the reasons for this limitation was the lack of the map that could convert imported movement into the activities of daily living, because the motor movement that are required in daily activities was not performed in the treatment process using a robot. In addition, study on robot-assisted rehabilitation performed in Korea and overseas were focused on simple repeated training on muscle strength or joint range of motion. However, these were deficient around the damaged area, and the motion of performance required in activity of daily of living was considered by applying the robot assist rehabilitation, which was dependent on the robot system itself. A Cochrane review, including studies up to March 2015, analyzed the effect of robot-assisted upper extremity training according to the onset period of the subjects. A study was analyzed with 320 patients in their subacute period who had a stroke no more than 3 months from the onset. Their results showed improvements in activity of daily living, but 10 studies with 397 patients who had a stroke more than 3 months ago did not show improvements in daily living activities. The result did not find any significant difference between the two groups. The robot-assisted rehabilitation in number of previous study exhibited clear improvement evidence, such as improvements in the proximal segment of the upper extremity and hand, improvements in hand muscle strength, on increase the joint range of motion of upper extremity, and improvement in upper extremity function. The critical patient-oriented approach of physical therapy for improvement of the activities on daily living and upper extremity functions for stroke patients has been applied more universally and particularly than before in rehabilitation treatment environments. This intervention method play an important role of establishing the proper therapeutic strategy and goal by making patient activity participate in all procedure of treatment. It is also positive and decisive method used the recover to independence of patient and improve their quality of life, allowing them to participate in task and meaningful activity again. Many research have proved that the patient-oriented approach is effective not only in subjective satisfaction but also in the recovery of body functions. Conclusion: patient-oriented robot-assisted rehabilitation was applied through the requirement of daily activity goal setup and analysis on movement of stroke patients in their subacute phase, and the results show that not only the upper extremity functions of patients improve, but their ability to take part of activities in daily living improved more than when using the previous robot-oriented robot-assisted rehabilitation. In addition, patient-oriented and robot-oriented robot-assisted rehabilitation strategies were more effective of the joint range of motion of the digital segment of the upper extremities, as well as the power of hand grip and pinch as opposite to traditional rehabilitation treatment. In contrast, both patient-oriented robot-assisted rehabilitation and traditional rehabilitation treatment were positively effective of improving patient activity of daily living compared to robot-oriented robot-assisted rehabilitation. Based on these study results, this study contributes to providing a basis that can apply the patient-oriented and robot-assisted rehabilitation to improve upper extremity function and activity of daily living of stroke patients in their subacute phase. Thank you for listening.